Welcome to Conversations With. My name is Shaley Hoogendoorn and I live with Bipolar Disorder. Sharing with others is healing, both individually and collectively. Sharing our stories will educate others, bring more understanding, shed more light, and smash more stigma. Our voices need to be heard. Our stories aren't over yet. This is Bipolar. Hi everyone, and welcome back to This is Bipolar. We are so glad that you are here with us. If it's your first time listening, my name is Shaley Hoogendoorn. I live with Bipolar Disorder. I'm a mom, a wife, an event planner, a school teacher, and podcaster, and I'd like to think fierce mental health advocate. And I'm really excited today because I have a guest that's from very far away and we finally got our schedules to work. So I'm really excited for you to learn more about Ellen. Ellen, can you tell us a few things about yourself?
Yep, so I'm Ellen. I am from Australia. So I live on the East Coast, just a bit north of Sydney. And I am a psychologist. I actually have a doctorate in clinical neuropsychology. But I also want to preface that saying I've mainly worked in pediatrics. So I haven't spent a lot of time working in kind of the adult mental health world. That's not my area of specialty. So I have the training, but yeah, it's not my specialty.
Oh, that's interesting.
Yeah. And I'm also a mother. I've got 2 little kids. I've been married for 16 years, something like that. And I travel a lot is my biggest passion in the world.
Yeah.
And I also do some mental health advocacy.
She does. And she wrote an amazing book. And I have it on my iPad, Chaos of My Mind. Did I get it right?
Yes.
A Bipolar Memoir. Yes. And we will be talking about that book. And I'll put it all in the show notes. But yes, go and get it. It's a really good. I read it in 2 sittings. So it was really, really good, really powerful. Of course, hard reads because we talk about hard things. And speaking of which, I just wanted to remind everybody that we do talk about hard things here. I don't so much say trigger warning just because I feel like the entire podcast might be a trigger, but also sometimes saying trigger warning, they're saying nowadays, makes you think of it first. So I just would like to say we are going to talk about hard things. Listen to your body. If you need to take breaks or you need to come back for a different time, please, please, please take care of yourself. So with that being said, I would love to jump into your journey. And I'm curious, at what age or when did you start to notice that maybe there was something different or maybe there was something wrong?
So I come from a family with significant mental illness.
Okay.
So we have, I have an uncle with bipolar. I have a brother with bipolar. My parents have their own mental health issues. So it's there, and it was always something we talked about.
Awesome.
So probably more than a lot of families. But within that setting, I was kind of the normal kid. I was the one that I went along without difficulties. I was always kind of did well in school. I kept my head down. I had a very nerdy group of friends, so we didn't kind of get into trouble and things like that. So outside things looked pretty good. But when I was a teenager was when I hit my first depression. And I just went from like, I loved school, I loved doing those things, and I just didn't anymore. I still did them, so it wasn't, no one else saw it. But I didn't love anything, and like that's the first time that I remember planning how I was going to end my life. Was probably around 16. So that would have been sort of when things were wrong.
I'm really curious and reading in your book. So just because September was Suicide Awareness Month, and I was thinking about it more, and I've been trying to learn a few more things. And I remember I would always say, no, I never had suicidal ideation or thoughts or anything. And then I start to really understand it. And I realized like, oh, okay, wanting to go to sleep like for a very long time is suicidal ideation. My bipolar is very cyclical.
Yeah.
So I didn't want to die because I just wanted relief. So I just wanted to sleep until I knew that the next stage would come. That was before I knew it was hypomania, right? I thought it was regular. Right?
Yeah.
Right. So I'm wondering if you could speak to that. Like, did you start with ideation and then, was there a quick move to thinking about a plan, or did it just start as coming to a plan to you? I just want to destigmatize that and help people really understand. I'd love to hear your experience, what you were thinking, feeling, how that worked at this time as a teenager.
I mean, it was a very long time ago, so
Yeah.
I struggle remembering exactly how that kind of played out. Like, it never got to the dangerous plan of I'm going to do something.
Right.
So it never kind of, that's the end stage of the planning. It was just very much I don't want to be here. I don't want to do this. And I guess I didn't have at that point of this is going to end at some stage. Like, this was the first time, and I can't remember how long it lasted or anything. I kind of remember it because I remember what my plan was. Right. And kind of like, so I remember that and thinking about it and just not wanting to be here, but I was never actually going to do anything.
Right.
To do it and that was mainly because of my parents, particularly my mother. I was like, I didn't want to hurt her, and I knew that would hurt her. So that was kind of my protective factor as to what stopped it.
Yeah. Yeah. It seems like the more people I talk to, that sounds and really, really similar, right? That it's not about holding on for yourself at first, right?
Yeah.
Yeah. And I think that's really, really hard for people to understand. Yeah.
Yeah.
I'm curious after that. So when this started, and I mean, I get it. It was a while ago, and you're 16. We don't know, like, half the time I can't even explain what I'm feeling now. When you're 16, it's really hard. Yeah. Did you reach out for help or talk to your parents, or was it more, like you said, you were the one that was like doing okay? Did you have that pressure? Tell me about that.
I definitely had the pressure that I was okay, that I was normal. So no, I did not reach out to help to anyone. I didn't let my friends know. I didn't let my parents know. The only thing that they noticed was that basically after dinner, I was just going straight to bed. Okay. And because I would have dinner, go have a shower, go to bed. And at one point, my mum was like, do you have bulimia? Because you're going straight to the bathroom after dinner.
Interesting.
I had a fear of throwing up. So I was like, no. Like, not at all. But that was the only kind of thing that got noticed, and that sort of interpretation. Yeah. Which was completely off the mark. Yeah. Oh, that's interesting. That's interesting that you brought it up, because let me know if this is your experience. But when I'm depressed, like the real depressed before my medication, do you live with bipolar 1 or bipolar 2? I forget. One. Okay. So when I would get in the deep depressions, I actually one time got diagnosed with disordered eating, because now I understand that it was something that I could control. So I would like binge and restrict, but it would only be when I was depressed. The rest of the year, I never even thought about it. Did you have anything, like, just that you brought up that clearly you didn't have bulimia, but did you have anything that you would try to like find some kind of control when you're depressed, or is it just so dark you're just coping? Eating never, like, I guess depression does affect my eating. So either sometimes I just lose my appetite. So it's not like restricting, it's just I can't be bothered and I just don't feel hungry, and I can't think what to eat. It's too hard. Or there's sort of, a bit of binging in terms of like, well, I'll eat lots of chocolate and stuff because you're trying to feel better anyway. Feel better. Yeah. But it's more along that line, not me controlling it. Yeah. I'm so curious about that, because I remember being so confused. And then when I finally got diagnosed, the psychiatrist was like, oh yeah, that's common. I'm like, all these like 15 years, because I was diagnosed quite late. So leading into, so you had this depression, and did you come out of it and go into mania, or was there some time, I'm learning the word for what I used to call normal times is euthymia. Yeah. I just learned that. I was like, oh, I thought that was like normal times. I'm like, oh, hey, which it is.
It is, but there's a fancy word for it. But I'm curious what happened kind of after that. And yeah, whatever you want to tell us in the next upcoming years after a teenager, what did it look like in your life?
So there was a mania. I don't know how long between.
Yeah, no
like
worries.
I would say the mania was kind of when I was 17.
Okay.
And again, I don't remember like, exactly what happened, but I remember kind of things like being up in the middle of the night and like deciding to chop my hair off at 3 o'clock in the morning. And my parents had gone to a talk and it was about the brain and neuropsychology and stuff. And epilepsy and surgery, and I was like, I'm going to discover how to grow brain tissue. And I started like coming up with all these ideas about how I was going to do that. And then I started writing a book about the theory of consciousness. And then,
oh my goodness, really?
Yeah.
Wow.
And then there was also a book series that I was reading, and then it was about teaching me how to access my magical powers. So I remember all that. So I'm fairly convinced that was a manic episode.
Yes, sounds like it.
But yeah, so that was sort of in that 17-year-old, and then I probably went back to kind of being stable after that. So that's my general pattern. I'm the opposite to a lot of people. I have a depression first, and then go up.
Okay.
And then I'm okay.
Yeah. And then the euthymia. Why do I say it wrong? Thigh or
euthymia?
Thigh.
I say euthymia, but could be a different accent. So
yeah. Let's go with it. I'm going to think thighs, and so I can say it because literally I do this for the past 3 podcasts. I'm like, say them twice. I'm going to think of. I'm a teacher, so I'm going to think of something to remind me.
Yeah, and then you do have dysthymia, which is people who are a bit lower but not depressed, and hyperthymia, where you have a bubbly personality, but you're not hypomania. So you have hypothymia, euthymia, dysthymia.
New words. Yes.
Yeah, there you go.
Hey, that actually would explain a lot, because I try and say, I use the language baseline because my baseline's quite high. So it was hard for people to tell I was depressed. But for me, it was depression. Oh, I learned new things. Thank you. Awesome. So when you did that, is it pretty cyclical in terms of timing? Like, like for me, it was fall and then all the way through winter depressed. Then May, it would be like literally to the weeks. And then I would be hypomanic, rapid cycling until the fall again, with periods of euthymia. I got it. What did that look like for you? Because I know some people are like, I have no cycle. Were there longer periods? Was it different each year? I'm so curious.
It was. So I don't have like a yearly cycle that goes along with the seasons, but it would tend to be, so I'd have like a depression, I'd have a mania or a hypomania, depending, and then maybe like a year and a half of euthymia.
Okay. Wow. That's long. Yeah.
Yeah.
Yeah. Interesting. So then you've gotten through high school. Did you go straight to university or school?
Yes. I went straight to university.
Yeah. Tell me about university and so you're still undiagnosed at this point, right?
Yes.
Tell me about university and having undiagnosed bipolar 1 disorder. Tell me something about that and how that went and what that looked like. I know it's really hard.
Yeah. I mean, again, I like learning things. So I, did fairly well kind of in that environment. I also met my husband at the end of my first year, and we started dating fairly soon after that. And he is a very stable person.
Yeah.
He doesn't have big emotions.
Yeah.
So he feeds off mine, which is sort of good because he likes it to a certain extent. And then he's like, no, it's too much now. But but so there were definite periods where he would actually come to my uni and come and sit in lectures with me to keep me going.
Oh, wow.
Yeah. And then there were other times, like I remember one year in the exams, I was obviously hypomanic probably. Yeah. And I just was like, that racing brain and kind of like, I'm finished it. And like, as soon as I was allowed to leave, I was like, oh, I'm done. Like, this is it. I'm a genius. It's fine.
Yeah. Yeah.
But yeah, I mean, it sort of went through really fairly steadily. But yeah, the support from my husband was huge in keeping it going. Yeah.
We talk about borrowing from nervous system. So my husband's pretty even keel too. So I borrow a lot from his nervous system. We always talk about that. Yeah. So when you had manic episodes during university, what does that look like for you? I can hear that you're saying where you have grandiose ideas, and also that you think you're awesome at everything, which
Yeah.
same.
Yeah.
But did they get really, really high? Did you do anything like reckless or outrageous in university? Was it really noticeable to your boyfriend, future husband at the time?
I didn't have any really extreme manias through that period, like nothing that was really, really outrageous. The only thing that was out of keeping for me was probably some hypersexuality, which was also a new relationship. And, you know, other than me being like, here at park, this is a good idea. And my husband was like, no, we're not doing it in public. You know,
it's a great idea. Yeah.
So that's probably like very out of keeping for my personality.
Yeah.
That was going on. But again, it was only with him, and
it was in the realm of, yeah. Okay. Interesting. That's so interesting. And he, your husband, did he notice the low lows? Like, did something click for him? Was he wondering, or he just thought that's like your personality and who you were?
Yeah, he saw it and knew it, but didn't diagnose it, I guess, or like it was just, that's you, that's how life is.
Okay.
And so like when I finally kind of went for the diagnosis thing, and I was like going to the doctor, I'm like, they're going to tell me I've got bipolar disorder. And he was like, what? You're kidding me? Like, no, where's that coming from? And I printed out the diagnostic criteria from DSM and went, here's that. And he read it and went, oh yeah, they are.
Right. So, right. Oh, wow. So tell me, so while you're going through this, even, you know, that it runs in your family, and it seems like you guys have in your family have a lot of awareness about mental health and mental illness. Were you thinking at the time, this is something I probably have, but I'm not going to go get help for it? Or were you just coping? Or tell me what's going on about thinking about those things.
I think I was in real denial.
Okay.
So I don't remember ever kind of thinking I might have bipolar disorder.
Okay.
At all. Depression, yes.
Okay.
But yeah, until I got to the bit where I was actually going to see a doctor, I don't think I'd ever like consciously thought about it. But I think it was probably that denial thing of, I'm the normal person, and I just, there's nothing wrong with me. I'm fine. I'm just going to get on and do life. And yeah.
It's like those family roles or things we believe about ourselves. I know I always thought like, because I didn't understand hypomania or anything like that, and I'm the first one in our family that's diagnosed. As a lay person that's not a doctor but knows her life, I think there's definitely undiagnosed in my family as well. So I didn't have anything to go on, but that's so interesting, that whole roles, right? So I thought, well, I'm just really efficient, and I would get so many compliments when I was like organized, or you have so much energy. Like, you get these compliments for this behavior that's actually, they don't see behind the scenes that you're like frustrated, not sleeping, like all the things, but it's so much better and depression that it's almost like I ignored all the hard things about that time. Did you?
I know, like when that you know, that hypomania would come, I'd be like, this is me, I'm back, like this is who I am now, like
I am the funnest, like everyone. That's the same with me. So you make it through university, you still haven't gone for diagnosis. Have you seen a doctor at all about? Nothing?
No.
Okay.
So I didn't see a doctor until I was 30.
Okay. So when did you graduate from university? How old?
So my undergraduate, I would have been 21.
Okay.
22 when I graduated, and then I had a year break, and then I did my doctorate. And so then I didn't graduate that until I was 26, almost 27.
Wow. So you just kept going in there. That's so interesting. And I bet other people probably didn't notice either, or in your family, because my GP, like my general practitioner doctor, we brought him the list and was like, hey, I think this might be a thing. And he's like, you wouldn't have a degree. You wouldn't have your 2 children and be okay, and da 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 da. And that put me back like a ton of years. So I can imagine that, because you finished your university degree, you went on to your do you call it your
Doctorate.
master's there?
Doctorate. It was a doctorate. Yeah.
Oh, okay, so your doctorate. People must have been like, she's fine. Yeah.
I've got it all together.
Yeah. So did your schoolwork suffer when you were depressed, or did you have certain strategies that you were able to use to get around that? What did that look like when you had major depression during those times?
It didn't suffer that much with it. I mean, as much as sort of like that thing of having to be normal was bad because I couldn't seek help, it also was beneficial because I'm like, I can't let anyone see what's going on.
Right.
So therefore I have to keep producing and doing, and there sort of isn't a choice. Like, this is just what you have to do. And like, even when I was suicidal and things, it was sort of like, well, I'm just going to keep doing until I die, and then and
no one will know.
Keep doing.
Oh wow, that's interesting. I know, and I feel like you might relate, let me know, but I feel like a lot of times, like, I didn't feel valid, or I didn't feel like my depression was valid because of what we see on TV, or what, other things. And I don't like the words high function. I feel like we need new words. High functioning makes it sound like you're better, and it's not. It's just different. But I was the same in that I got out of bed to do the things I had to do. Like, I would go to school, I would do the things, like, if I was going to make dinner, if it was my turn, whatever, do those things. But any other time out of those things, I just wanted to be in bed and wanted the day to be over. And I think that it's really important to let people know that within bipolar 1, within bipolar 2, or other, it's a whole spectrum that people say, I would have never known, but it's because we don't understand that there is a spectrum, and that you can. And then for a lot of things with my depression comes perfectionism, right? And then it's a cycle of even being even more depressed because I can't live up to this perfection that I make in my head, because I feel like a loser no matter what, right? Nothing's good enough kind of thing.
And I think, for me, certainly, like, going to, when I did start seeing a doctor and saying I'm depressed and I'm suicidal, and they're like, oh, but you're still going to work, and no one at work is noticing or commenting. So they didn't really believe me. And because I was depressed, I literally, those was all I'd say, like, I'm depressed, I'm suicidal. And I would just sit there. And when they were giving me medication, I'm like, it's not working. And they're like, oh, well, we'll keep trying for a bit, because they didn't get it. And I couldn't really explain it at that point in time either. So
that's so hard, because it's like, I know that it takes everything to even get to the doctor. And then you have to have like this perfect language to be able to describe it, and you can't. And then, and then I'm someone that's just like, my mom was a nurse. So I, like, doctors, nurses, I listen, like, if they say something, I'm like, yep, I was never good at advocating or saying, because I'm like, well, they're the expert, right? So if anybody's listening, if you feel some of these things and your doctors are saying something else, your body, and how get someone maybe to go with you, or when you're feeling in an okay space, that's when I write down the things, right, that I remember. Because when you're depressed, like, the thought of writing a list of how you feel, it's no.
I can write more than I can talk. So for me, writing it down to give it to a doctor would be much easier than saying it.
Oh, that's awesome. That's great advice. See, I'm like I need to record it. I get anxious about writing down, and like, I laugh, but I get anxious about journaling. So I'll be like, whenever they tell me journal, I had to find a way to do it speaking or other ways, because I'd be like overthink it. Like, how much am I supposed to write? When is this going to be done? I don't know if I'm doing the right thing. Is this how you're supposed to journal? And I'm like, I just want it to be over. I'm the same about crying. It's like, they're like, do this for calming. I'm like, no. I know myself. No. Yes, but that's awesome that you can do that, because you can just pass it, right? And sometimes it's so, if we self-stigmatize, it's so like discouraging, or, still, even though we know we don't need to, it's embarrassing or awkward or whatever. So I love I love that idea of people writing and bringing it.
Yeah.
That's awesome. Okay, so we're going to dive into the really hard parts, because your book, talks about it a lot, because that was your experience.
Yes.
I want to talk about how just the progression of suicidal thoughts. And just for people that are listening, we are going to be talking about an attempt and different ways. So again, if that's activating in your body, just a heads up. But I just walk me through that, because I read your book. I read it right away when you sent it to me a couple months ago. So just refresh me on, like, it doesn't even have to be a timeline, but just kind of how that progressed for you and what that looked like, because it became a hyperfixation for you, right? It became, tell us about that, because like you said, on the outside, you're going to school, you have a practice, right? Like you were working.
I was working in a hospital. Yeah. So.
Yeah, working in a hospital, right? So tell us, I'd love just to hear like what that looked like and felt like for you, and just the timeline, whatever you feel comfortable sharing. I'd really like to hear.
Yeah. So that year, so this was 2011, that's kind of all happened.
Okay.
And so I hit another depression. It wasn't anything standout. It was just kind of like, this is just what it is. And I had a friend notice, and it was the first time in my life that had ever happened.
Okay.
And that was really powerful. And like, it was the first day she'd seen me after I got depressed, and she was like, something's wrong. And I'm like, no, I'm fine, I'm just tired. And she's like, are you depressed? I was like,
wow.
Yes. And that was like the first time I'd kind of ever said anything to anyone other than my husband, like it. So that was really powerful. And then she basically hounded me about going to a doctor. She was like, you need to see someone about this. And so that was sort of where that started.
Yeah.
And so, yeah, for me, the kind of suicidal thoughts, they start pretty quickly in terms of that, just, I don't want to be alive anymore. And that kind of, in some ways, thinking about or imagining it is kind of like a comfort of, there is a way out. And I just don't want to do it. But it wasn't like in the planning, this is what I'm going to do. Okay. And I don't think that really escalated until after I'd kind of sought help, been to see, there was a psychiatrist who was really useless, was very invalidating, didn't listen to me, and I chucked away the medication that she'd put me on because it was making me feel like crap and wasn't helping. And she didn't listen.
Like an antidepressant?
No, she'd put me on Epilum, but it made me really, really foggy, and I felt really horrible in myself. Like it wasn't making any kind of difference. And she was like, oh, well, we'll try for another month and see. And I'm like, no. And it chucked that away. And then I was like, oh, I'm just gonna push through it like I normally do, and we'll see how that goes. And then I had 2 people die in a space of a week. So a friend and my uncle died in the space of a week, and the grief that I felt from that cleared away my depression.
Okay.
It was 2 completely different emotions, because depression was all about hating myself and everything about myself, whereas grief was the sadness about losing these people. And that made me go to the doctor again and try again, because I was like, I can't cause this to other people, and kind of experiencing that, going, I can't risk that's going to happen. So then I kind of started again with the doctor, and again that was the kind of where I was in the I'm depressed and suicidal, and they were kind of like, oh, well, you've just had this, lost 2 people, so it's to do with that. And I'm like, no, that actually helped me feel better from the depression. And now it's come back, and the medication you're putting me on isn't working. And as that was kind of going through, that hopelessness escalated, because I'm doing what I should do and it's not helping, and I'm never going to get better. Like this is, so I think it was having that ineffective help was kind of what escalated it to the point of, I can't do this. And I started to have some psychotic symptoms,
Right.
enter in there.
Yeah. What
So
did
I had
that look
loose.
like? What did that look
So
like?
I didn't realize until later that I had them, but
Okay.
I lived in a very quiet suburban area,
Mm.
and I would walk home from work and I would hear someone yelling very mean things to me and telling me they wanted to die, and I couldn't see them.
Wow.
And I was depressed enough that it made perfect sense that some random stranger would want me to kill myself.
Wow.
And I just couldn't see them. And it never occurred to me that I
Right.
was hearing voices. So when
Yeah.
like the doctors were like, "Oh, do you have any hallucinations?" I'm like, "No." And it wasn't until it stopped and I was like, "Huh,
Interesting.
probably wasn't
Yeah.
real."
Wow.
So that was one. And just the kind of the belief that I deserved to die
Mm.
and that everyone would be better off kind of got to more of a delusional point of view of like,
Yeah.
this is what I deserve.
Yeah.
You know,
Yeah. I
yeah.
think that's what's so hard for people to understand. I know I had posted something about not using the word committed anymore and talking about, died by suicide and just the difference. And I'm not going to go all into that, but it was like wild. People had very strong feelings about it. And I just, and now I feel like even more determined to show people what people are actually thinking, and that
Yeah.
not to like, demonize it or make it seem like, how are we doing this to people that feel like you have to have very little hope? You're not trying to do something to
Yeah.
upset other people. It's not like a revenge thing or a terrible thing. And I just keep hearing over and over that, I'm a burden. I don't deserve
Yeah.
to be here. Like your brain is lying to you. And I think that, I just wish that there was like more compassion, because it kind of
Yeah.
feels like that comes after if things
Does.
don't work out, right?
Yes.
And everybody, a lot of people, like, we had no idea. I'm like, I want to live in a world where we have idea, like we know we have idea. Tell me about, because it just stuck out for me and it's a huge part of your book. Tell me about, you talk a lot about escapism. Like, so this looks like to you, this is a way out. This is a way out of the sadness and the darkness and the hating yourself. This isn't like checking out just because. And so I know you talk a lot about the rope, and I know it's really hard to talk about. Yes, tell me what you would like to share about that, because I just found that just a really, really powerful part of your book.
Yeah. So I guess I researched a lot as to what was going to happen, and for a while, and then I ended up on the I'm going to hang myself, and this is what's going to happen. And I found this rope at home, and so I tested it in various ways to see if it would work. And it wasn't at the point of like, here's the time I'm going to do it, but I was coming up with, like, it was getting to that point of this is going to happen, and I had it with me all the time because I'd made the noose
in your purse, right? You had it like in your bag and stuff.
Yeah, I had it in my bag.
Found that. Wow. Yeah.
Partly because I didn't want my husband finding it, so I was like,
fair enough.
He's not going to go through my bag. No one's going to go through that. So this is the place that it's kind of hidden from anyone. So, and it ended up, it was a dodgy rope, which is why I'm still here.
Well, I am happy it wasn't a dodgy rope.
Yeah. But I had that, and a couple of times it got close. I always find it interesting where people count an attempt.
Yes.
Because
tell me about that.
I know there are a few things that I did that I didn't count as an attempt.
Okay.
Other people would. So I guess one of the more notable ones, like I hung up sheets to hide my body and stuff so no one would see it, put up notes and all that stuff. Like I was thinking it was going to happen. I hung it all, and then I took Seroquel hoping it would make me fall asleep.
Yes.
And end it that way. And it didn't. It just made me really nauseous, and I ended up packing it all away and clearing it up and not doing anything. So I didn't in my head count that as an attempt because I didn't actually get off the stool kind of thing.
Interesting. Yeah.
that was where it needed to be before I considered it to get to that level of being an attempt. So then that was a few weeks later, month later, where I actually stepped off the stool that time and tried to end it. And then when that didn't work, I completely broke. And then I told people, because I'm like, I can't even do this. Like, I don't know what to do. Like, this is,
I can just in the teeniest level relate in that feeling like we feel like such failures. I remember when I went for help and they said I wasn't sick enough to go to the psych ward, and I was like devastated because I was like, well, I'm not even like sick enough. Do you know what I mean? You're saying like, I can't even, I'm failing at this. So it got you to spiral. When you were doing the research and the planning, and I know in the book, like the testing and such, in that moment, did you feel relief from the depression, or you just on auto mode, or what? Tell me, I'm just so curious.
No, I didn't, definitely wasn't relief from it. It was just, I didn't want to have a failed attempt. I didn't want to have an attempt. So I wanted to make sure I knew what was going to happen and everything. So
that's fascinating. That makes sense. That makes a lot of sense. Also, too, when you talked to it, that same friend was kind of came along. And that's the part in your book where you wrote about how, what's it called? Like how not to tell someone that you attempt. Did you have three? Tell us about those. Because I found that really interesting. And for those of you that, I always feel like I have to say this because I feel like I'm going to get hate. For those of you that are like, why are they like kind of laughing or being awkward about it? Because
you have to.
Exactly. We're not being nonchalant, and this is very serious and heartbreaking, and I bawled in your book. But just for people that listening that don't experience any mental health disorders or anything, it is a release, or we just have to. So please don't think we're not taking it seriously, and send me messages that I'm not taking it seriously, because I am.
Yes, no, it is. But you can't.
I know.
You can't just cry every time you talk about it.
I know. And I appreciated that part in your book. It almost felt like a little bit of a, okay, back into the story. So tell us about those, because I loved reading about them.
Yeah. Okay. So I had I do this thing of like how not to tell someone you tried to kill yourself, because it's a really awkward thing to do, and I did it wrong pretty much every time. So the first time was just afterwards, when it hadn't worked, and I called this friend, and she had been supporting me all the way through it. She knew the most of my thoughts, probably even more than my husband. She's another psychologist, and she was, I guess, able to hold it a bit more for me in that way. And I just called her, and I didn't say anything. I was just breathing down the phone and sobbing, and she was like, what's happened? And I didn't say anything. She's like, are you safe? I said, yes. Were you safe? No. Wow. And then she came over. And so that was kind of how I told her, which, and she just left work, came, sat with me, got me to call my husband. He came home. We sat, we talked. So I guess this is where the book came in. So I'd initially started writing it. I was going to write a book. I was manic. I was going to write a book, and it was going to explain bipolar, and it was amazing, blah, blah, blah. And then I got depressed, into this depression, and I kept trying to write the book, but it became more and more about me, and then it felt fake. And then, so I made it about me. I converted it to okay, let's do something that's actually honest. And I kept writing it, and it sort of had all my thoughts in it. At the point I tried to kill myself, there was a 5,000 word suicide note that I printed out, because I'm like, this explains what's going on in my head. And so I got my friend and my husband to read it, and they both sat there crying, going, I didn't know how you felt. And I'm like, how did you not know? I've been trying to tell you. You're the people I've been the most honest with.
Yeah.
And even they hadn't really understood what was going on. So that was the first time of telling someone. And then I had another friend who I wanted to tell. And again, I'd messaged them saying, I have to tell you something. And they were like, okay, you're freaking me out. What is it? And I'm like, I've got to do this in person. And again, I just basically broke down. I was like, I tried to kill myself. And they were like, because they didn't know. And then there's also like trying to tell work and people like that, because so even after I had tried to kill myself, I was terrified of being put in hospital because I didn't want work to know. Right. And this was like the worst thing that could possibly happen, would be work finding out what was going on.
Okay.
And it wasn't until I was better that I'm like, I can't let me keeping this a secret kill me. So therefore I need to tell more widely what's happened. And I'd rehearse it all in my head as to what I was going to say, and I'd get in there and I don't know how to say this. Like, how do you bring this up out of nowhere with your boss and go, this has happened and I don't need anything because I'm doing better now, but I have to have it known. So if I get there again, I can ask for help.
Wow. That is huge. Were you afraid that you might lose your job, or more like ego wise, like you didn't, like it's your job, you didn't want people to know and think that you're maybe like not good at your job or something like that? What were you thinking?
Yeah, I think I wasn't worried about losing my job because I worked for the Department of Health, and
you would hope
that can't really happen. But it was more about the stigma and about like, people judging you, or even like people monitoring you. I didn't want that. I don't want people going, you're a bit quiet today, like is something going on? Like, it's like I can do my job and I can do it well. Yeah. It's more about I just need to be able to seek help. Like I don't need anything happening. And so it was that worry about that kind of stigma and stuff going on. Yeah.
Wow. So at that point, with your friend and your husband, they know. So at that point, do you go back to the doctor and start pursuing diagnosis even further? Tell me about how that came to be.
Yeah. So basically, the doctor that I was seeing at that point was a GP, so in our system, general practitioner, who had a special interest in mental illness. Okay. And so that's who I'd been working with. And then told her what happened, and she went, I can't help you, basically, and sent me to a psychiatrist. Okay. And that was the best thing that happened, because that psychiatrist was amazing. Love her. She was great. And she was the first doctor that I'd seen that really helped. So that kind of happened. And that first appointment with that psychiatrist, we'd sort of gone through the history, and then we sat there for about 5-10 minutes in silence while she went, am I going to force you to go into hospital? Because, and in hindsight, she should have, but I lied quite a bit to make sure that didn't happen. But that was the best thing, because then she changed my medications, got me on the right medication, got me through it.
Right. Yeah, it's interesting, right? Like that question. I found, for some reason, I found that question. I find it because people, and it needs to be asked, but are you going to harm yourself or others or whatever? I remember finding that just like such a like stigmatized, humiliating question for me. For some reason, that was like a huge question. And I think, like you said, she probably should have. So there's no shame if you are someone that has gone into the hospital, or sometimes, even though I know there's terrible experiences and good experience, sometimes it's the only choice. And I don't know what it's like in Australia, but we don't seem to have a middle ground here in Canada, or I would probably say North America, where it's like, here, even though it's free, you're on a waiting list. It's like, oh, hey, I'm not doing very well. Oh, okay, you can see a psychiatrist in 3 months. It's like, well, what about in the in-between, where maybe I don't really want to be here, but like you, functioning and haven't, quite done, but there's no like in-between care. You have to either go to emergency and get hospitalized, or wait. Is it like that in Australia?
Yeah, our mental health care, like we have, free healthcare as well, but mental health care, not so much. It's very poorly funded. So trying to get into the public system for that unless you are going to kill yourself like tomorrow, it probably isn't going to happen.
Wow.
Like it's just not really a thing so much. So you tend to have to go through the private system, and like there's a rebate, but there's still a gap you have to pay. So I think some psychiatrists will bulk bill so you don't have to pay, but it's pretty rare.
Oh, that's interesting. See, we don't even have that option, right? Like you can't, you don't have an option to like, hey, I'll pay, which is terrible if you're like privileged, right? Like it should be equal, but yet it's like equally bad.
Yeah.
You know what I mean? Like, so yeah. Oh, that's so interesting. Okay. So tell me about, so I remember there was this one part about when you would walk near, was it hills or cliffs or something, and your friend was trying to get a hold of you. I remember that part in your book. Am I remembering correctly?
Yeah. I mean, there was probably a couple. So I think there was, so early on, before I'd kind of settled on the hanging thing, I did go to, there's a very well-known suicide spot in Sydney.
Oh, really?
And so I'd been there. I went there at 2 different times.
Okay.
And that one I did, so the one time I went there and I did think I was going to go through with jumping. And I did feel clearer once I got there. I was like, you know what, I can wait. I can come back tomorrow. I'll wait. And that friend had called me before I left, because I was supposed to be meeting her and I cancelled that because my husband would think I was with her, and you know. And she said to me, like, basically how important I was and that this was going to get better. And when I was there, I was like, maybe she's right. So I'll go home. And then there was another day that was getting close to when my actual attempt was, where I'd gone into the bush that sort of was between my work and my home. And I honestly, I get very agitated depression, which is the one that's dangerous. It's when it's just, I've got the racing thoughts going on, but they're all negative. And that was kind of where I was, and just, I can't think, I can't do anything in that way. So, I was sort of in the bush and she was trying to find me, and
I am so grateful for your friend.
Oh my,
she's so like
such a special person,
a lovely friend. So for those of you that are worried about your friends, point blank ask, right?
Yes,
point blank ask. We don't have, let's not tiptoe around, just ask. It's so awkward, I'm sure, but as you can hear, it's helped save Alan's life. So you saw the amazing psychiatrist and you started getting the help. What does it look like since then? So do you still get suicidal thoughts? How does your medication help? Because I know for me it mutes, or for other people it takes some parts away and not. What does it look like for you since you've found the right medication?
So I have had a couple of like relapses. So initially I was like, okay, this is done, I'm on medication, I'm going to be fine for the rest of my life. Like I knew the statistics, which is like 80% of people with bipolar will still have episodes, even medicated. But I was like, no, I'm in the 20%. I was wrong. But what I found is that they were able to be tweaked with medication to end it much quicker.
Okay.
So when it has happened, it can get tweaked. One time I relapsed because I'd stopped medication. Again, don't recommend that, but and so that took longer to end because it takes.
So when you did that, were you manic or depressed, or were you just thinking like, because sometimes I convince myself, maybe I don't even have this.
I was in the maybe I don't. I'd been stable for quite a while and just was like, my psychiatrist had moved, and it was further away from my house. So I was like, oh, I'll find a new psychiatrist. And then I didn't. So I didn't actually have a psychiatrist.
Right.
And so I very slowly weaned it. Like I didn't just stop it, but I took like a little bit off. Oh, nothing's happening. Okay, we'll take a little bit. And then I was medication free, like for a while, 6-9 months. And then I got depressed again.
And
to start
did the thoughts come back then in the
yes,
relapses, and like
yeah,
back to suicidal thoughts?
back to suicidal thoughts, back to I deserve this, I don't deserve to get better. So I would start taking medication, then stop because I deserved to feel
Yeah.
like that.
Yeah.
And then I finally got back into the same psychiatrist I had. I was like, I'll travel, it's fine.
Yes.
And she was like, did you start the antipsychotic again? And I'm like, no. She's like, let's start that as well.
Yeah.
And so I started that, and then those thoughts about I deserve to suffer and deserve to die went away. So the antipsychotic for me
Does that.
gets rid of those. So
Yeah.
that's why I think they're a little bit in that delusional kind of way.
Yeah.
Because
Yeah.
it's the antipsychotic that
takes it
gets rid
away.
of it.
And that just shows, like, I don't know how people can still think that it's like a choice or like a, right? Like when a medication works that drastically, like it is a brain disorder, right?
Yes.
It is medical. But
Yeah.
I hear you with the other part. In fact, it sounds kind of different to say, but just over the past, like I was diagnosed in 2010, so 12 years. And just in the past little bit, the word, even though I've known it, the whole word like chronic illness and incurable, I knew that, but I didn't actually think about that before, right? Especially when you have long periods of euthymia or feeling regular. I mean, there wasn't even pre-medication, like there were long periods of like, I'm fine. Like I had kids, I mean, as fine as I could be, but it isn't, I think that's a big myth in that you're always either one or the other. And some people might experience that, but from a lot of people I talk to, there are periods, short, long, different periods of that. So that's what makes it so tricky. Tricky, right?
Yeah. I mean, there's so many reasons people with bipolar come off medication from that. Oh, I feel fine, I must be fine.
Yeah, exactly.
You know.
Yeah. And I find too, like I was much more on my healing journey, kind of managing once I could be like, hey, if I have to take this forever, so what? Because there's kind of this thing in our society that's just like, when are you going to get off medication? Or like, it's a crutch. I'm like, no. And like you're saying, I actually have suicidal thoughts and plans when I'm not on this medication. Why would I ever stop taking it? Right? Oh, that's so interesting. I would love, if you don't mind, I would love to read just a short excerpt from your book. I have it here on my iPad. Just because I think for those of us that struggle, we might be able to identify, and I just thought it was written really beautifully. And for those that love someone or just here trying to understand, maybe it can just help that understanding a little bit more. So it's in the, I believe, chapter called Knife's Edge. And it says, burnt, broken, failing, falling. Help. Someone please help me. Destroyed, empty, scared to drop again. This was probably when I was supposed to call my psychiatrist or psychologist and ask for help, but that scared me too. I saw that as weakness, and I was already so weak, fragile, crumbling into nothing. There was so little left of me that I couldn't cope with anything. I sat at my desk feeling pathetic, useless, and incompetent. My office door was open, but I was unable to move from my computer to shut it because the tears wouldn't stop rolling down my cheeks. And I was terrified that someone would see and ask what's wrong. There was nothing wrong except me, except my useless, broken mind that couldn't hold on to any positive emotions, but relished in the misery and pain. It felt so much harder after a moment of normality. You had talked about a time, I think it was acting or something, which was your time of normality. The moment last night when I felt, the moment last night when I felt enjoyment on stage, but it was so brief, such a small moment of joy. And to lose that again and to find myself back in the darkness was unbelievably painful. And I'm just going to add one more part, not because I'm trying to wrap it in a bow, but I also thought you go on to talk a little bit more. And then I just loved these lines. It said, the hopelessness was threatening to overwhelm me. I knew that was dangerous. I knew I needed to hold on with all my might to some sliver of hope, but I didn't know how. And I thought that I like highlighted it on my iPad, and that was just So powerful. How does that feel having someone read your book or that part to you?
It takes me back a bit.
Mm.
Yeah, because I don't know about you, but I find like if I'm not depressed, I don't really remember what it feels like.
Yes.
Like when I am depressed, I can't remember what anything else feels like. And the same with kind of like mania. It's like
Yes.
it's whatever emotion I'm in. I'm like, I don't remember
The other one.
to feel it.
Yeah.
Yeah. Whereas like having the book that's written in that is
Wow.
like that takes me back. And I feel sorry for that person because it's like that's
Yeah.
not really me. Like
Yeah. It's
you know,
almost like you personify it, right? I've been trying to do that with my anxiety as well, because that's the one that makes me feel like a lot like what you described, like a failure or whatever. We're back here again kind of thing. And I've tried to, I like gave it a name. I like
yeah.
being a teacher. I like alliteration. So I call it Agnes anxiety, and just, it
I
seems
love that.
so ridiculous when my psychiatrist was talking about doing this, but it helps because you're able to distance yourself from like it being something fundamentally wrong with my personality, right?
Yeah.
Yeah. Yeah, that was really, really powerful. So before we wrap up, I could talk, I don't want to tell everybody your whole book, so they will go and buy it. Tell me about, I would just love to hear, one, how you were doing this week. And then two, what would you say to someone who's listening right now and identifying with a lot of the hard parts of your story? What would you say to them? So a two-parter. Just, I'd love to hear about this week, because I know sometimes it's too much to ask about how are you doing now? And then also if you had something to say to others that are finding themselves in your story.
Yeah. Well, I guess at the moment I'm in a fairly good place. So I have the emotions that everyone has. I have 2 little kids. They give a lot of emotions, but it's euthymia. There's good days, there's bad days, but it's euthymia. It's not anything problematic. And in terms of what I would tell other people, I mean, there's sort of two bits that I kind of want to say of like,
Please.
What I think I would do for someone in my life. So if you're listening and it's someone in your life that you're worried about, the most powerful thing is being there. It's not what you say. It's about being there. It's about doing things like, I'm at the shops. Can I pick you up, a roast chicken? Or like, can I actually doing things, inviting someone, even if they say no a lot, just letting them know that you care about them.
Yes.
That you're there and that you value them as a person. So that would sort of be for that. And if you're someone who is in that struggling, is to reach out and tell someone, because people do not know what is going on in your head. They don't pick up subtle cues. Everyone is way too wrapped up in themselves to pick up what's going on for someone else. Like you do, as hard as it is, you have to reach out and let people know, whether it's a doctor or a psychologist or a friend or whoever it is, and try and explain it, whether it's recording it or whether it's writing it down, whether it's, whatever's going to make it easier for you, whether it's reading a memoir that makes sense to you and going, read this. This explains how I'm feeling. Get that.
I know some people have like sent people different episodes of our podcast. I feel so honored about that. And books and such. That's really, really powerful advice. Well,
one of my favorite responses I had to my memoir was I gave it to a friend to read, and she read it, and then she had a really good conversation with her sister, who she knew had struggled and she'd never understood it, and she read the book and went, I didn't know, and had a real and honest conversation with her sister. And she's like, it's the first time, but I've really listened to what she had to say. And I'm like, that's why I wrote the book. Is so people have those conversations.
Oh, I love it. I am so grateful for you, and I'm so grateful for your book. I just think it's really, really going to help people. Yeah,
Yeah.
it is. And I just want to let everybody know that I'm going to put all the details, but yes, go and buy it, read it. And just a reminder, you don't have to live with bipolar to read these memoirs and stories. In fact, I think it's of even a more importance, and that it will help break stigma by people just learning about other people, so that they can flat out ask. And I am so happy that you and your book exist. And I love what you're putting out on your Instagram as well. It's really, really helpful. And so thank you for showing up vulnerably today and sharing things that are really, really hard to say. I really appreciate it.
Well, thank you for having me. It's been nice. It's been nice talking. Yeah.
It was really nice talking. I always feel, yeah, it's so bizarre to explain to other people how I feel uplifted after a hard conversation like this. But yeah, awesome. Well, thank you so much. This is Bipolar. Thanks again for tuning in. You can find video versions of This is Bipolar on our YouTube channel. We also have all our previous and soon to be future episodes of the podcast on Apple, Podbean, Spotify, and Google Play. We spend most of our time on Instagram at this.is.bipolar. There is a vibrant community there where we have conversations and post different ideas and different strategies, and we'd just love for you to join us there. It is so helpful if you enjoy our work or think it would be helpful to someone if you could like and share and save and follow us in all or any of those spaces. If you're a listener for the podcast, if you could leave a review, we would be forever grateful. Again, thank you for being here with us. Let's get the word out. Let's share lived experiences so that we can change the ideas that people have about bipolar and help those of us that live with it feel less alone. This is Bipolar.